Watch this video to have all your questions about the standard pathway process for registering as a doctor in Australia answered. Hello, I'm Dr. Anthony Llewellyn. I'm the Career Doctor here on YouTube, here to help you manage your career. So over the last year or so, I've been really pleasantly surprised and happy with the level of engagement from doctors from all over the world about me going to lengths to try and explain what it can often be a very complex process in terms of how does a doctor from another part of the world come here to Australia and go through the process of being able to work as a doctor here. And one of the common topic areas that we're often discussing, whether that be on the Facebook group, on the YouTube posts or on the blog, is around the standard pathway process. It's one of the common processes that doctors from other countries go through in order to work here. So I've compiled a list of common questions and I thought it would be handy if we went through them right now. So let's start with the obvious first question. What is the standard pathway process? Well, the standard pathway process is a process where doctors who have medical degrees from outside of Australia can apply to have their capability as a doctor evaluated in order to work in medicine in Australia. The process is intended to ensure that doctors are competent to the level of an Australian doctor at the point at which the Australian doctor has graduated from medical school and has gone on to successfully complete a provisional intern year here in Australia. The pathway applies to international doctors who do not have specialist qualifications and who are not from one of the 4 competent authority countries. So the majority of international doctors seeking general registration in Australia do actually end up going to the standard pathway process. The medical regulatory system in Australia recognises 4 other countries that are deemed to be equivalent in terms of their approach to medical school and the outcomes achieved from medical school. These countries are the United Kingdom, the United States of America, Canada and the Republic of Ireland. Also, doctors who graduate from medical schools in New Zealand are also seen as being equivalent by virtue of the fact that the Australian Medical Council actually also accredits medical schools in New Zealand. This means that if you graduated in medicine in one of these countries, these 5 countries, you have much more streamlined pathway available for being able to work in Australia as a doctor. In addition, some international doctors who have been through the process of getting registered in one of these competent authority countries will also be able to apply via the competent authority pathway. For example, if you've successfully completed all steps of the PLAB process in the United Kingdom. The Australian Medical Council examinations, or the AMC exams, are a core part of the standard pathway process. You have to pass both of these exams in order to be able to complete all the steps in order to go on to obtain general registration. According to the AMC itself, the exams are set at the level of attainment of medical knowledge, clinical skills and attitudes required of newly qualified graduates from the Australian medical school system. So graduates who are about to go on to intern training. The exams are 2-part. They consist of a computer adaptive test, which is a multiple choice question exam, as well as a face-to-face clinical examination. The MCQ exam tests knowledge and principles of the practice of medicine in the areas of general practice, internal medicine, psychiatry, surgery, paediatrics and obstetrics and gynecology. The clinical examination tests clinical skills and capabilities in those same areas. So an important thing to note here is that the AMC exams are clinical exams and do not involve being tested around matters of basic clinical science, things like radiology, pathology, unless they relate to some of those particular clinical areas themselves. You can sit for the AMC examinations anytime after you graduate from your own medical school. All that is needed to sit the AMC exams is proof of a primary medical degree. You must sit and pass the first AMC exam, the multiple choice exam, before you're allowed to go on and register for and sit the clinical examination. You can sit the AMC exams as many times as you like, but you can only be preparing for and registered for one particular exam at any point in time. Also, bear in mind that these exams are quite expensive. The AMC exams are quite expensive. The MCQ exam, for example, in 2019 costs $2,720 Australian. And the clinical exam is even more expensive, costing $3,530 Australian. And there may be other costs, for example, costs to obtain your AMC certificate at the end of the process. Bear in mind that actually these examination fees are generally higher than most of the fees that are charged for college trainees for college training exams in Australia. In essence, the AMC exams are pretty hard. The MCQ exam is relatively okay with a pass rate of about 60% per sitting. The clinical examination, though, is notoriously difficult with a pass rate of around 28% per sitting. The AMC exams run constantly throughout the year with a bit of a break over the Australian summer. There's no actual best time in terms of the calendar to sit the exams. They're the same level of difficulty at any point in time. But as the exams are a test of your medical knowledge and abilities at the end of medical school, it is generally considered that it gets harder to sit these exams the longer it has been since you've actually finished medical school yourself. So it's best to sit as soon as possible. Many doctors will actually sit the MCQ exam whilst completing their own internship in their own country. According to the AMC, there is no wait list for the exams, and no need for a wait list as they're able to offer enough examinations for both the MCQ and the clinical exams to satisfy the demand for these examinations. This is achieved by running a number of MCQ exams throughout the year, both in Australia and in other centres in other countries, as well as having recently increased the capacity for the clinical examination component. Whilst it may be true now that there is no wait list, there have certainly been concerns in the past, particularly in relation to waiting significant amounts of time to sit the clinical examination, with reports of in excess of 18 months between passing the MCQ and the clinical exam. And the process itself also imposes a bit of a waiting period, because once you've applied for and selected an exam date, you can't apply for another exam date. And you have to wait the results of your MCQ exam before you go on to either register for another MCQ exam if you didn't pass the MCQ exam, or go on to register for the clinical examination if you managed to pass the MCQ exam. In the AMC exams, you compete against the standards, so you're not competing against other candidates. So most doctors who have been successful in the AMC examination process will tell you that one of the best ways to prepare is to form a study group of other people sitting them. Generally, most candidates prepare by using examples of past questions, whether that be for the MCQ exam or the clinical examination. You can purchase official questions from places like the AMC itself, but there are also a number of other MCQ questions and clinical questions floating around in the digital space around the internet, as many people who sit the exams attempt to recall them after they sit them. Given the expense of the exams itself, it may be difficult to afford to pay for additional resources to help you sit these examinations. However, there are a number of textbooks and other resources that are available at a price. Most international doctors recommend purchasing a copy of Professor John Murtagh's book on general practice, as this covers a lot of the Australian specific knowledge for both the MCQ and the clinical. There are also a number of online tutoring and courses available, as well as face-to-face courses, which may even include opportunities to do clinical observerships. Yes, the PLAB and the USMLE can substitute for the AMC exam and get you out of the standard pathway process altogether, but only if you complete all steps required, and in the case of the PLAB, undertake at least 12 months of supervised placement in the UK, or in the case of the USMLE, undertake at least 24 months in an accredited residency program. Otherwise, these exams are of no use to you, and you have to sit through all of the AMC process. Yes, if you're from a competent authority country, you can apply via the competent authority pathway. If you're a specialist, you can also apply via the specialist pathway. If you're fortunate to be employed at one of the 10 places in Australia that are accredited for workplace-based assessment under the AMC, then you'll also most likely be able to do the workplace-based assessment program, which is an alternative to sitting the clinical examination, and is generally considered better because A, it's cheaper, and B, the pass rate is generally much higher through that process. You've probably read something on Facebook or even the medical board website itself telling you that you need to complete an internship to be able to be registered in Australia. In most cases, you probably do not actually need to complete an internship, as you will have done something similar in your country, whether that's part of your medical degree or after graduating. In general, the medical board here wishes to see evidence that you've been granted a full licence or general registration in another country prior to being able to register you through the standard pathway. If you have not done an internship in your own country or obtained full registration, then you do still need to complete an internship. But you are far better off completing this in another country than trying to do this in Australia, as the chances of being able to actually get an internship here from an international doctor are very extremely low. Most likely the answer to this question is yes. However, you may have some options to be exempt from this requirement. For example, if you can prove that all of your high schooling occurred in English. There are minimum requirements for the various English language standard tests that you can do. We've done a blog post about this and I'll leave a link in the description below. But as an example, to able to gain registration, if you sit the IELTS exam, you need 7 or above in all 4 domains of this test. Many doctors think that achieving the minimum requirement in English is all that is needed. However, the minimum requirements often correlate with being less than sufficient in the employer's eyes, and can often mean that you're even rejected from being considered for an interview, or can be one of the reasons cited for not giving you the job after the interview process because the panel felt that you lacked the exact amount of English communication skills required to undertake the challenge of communicating in an Australian health service. So you should endeavour to practice and build on your Australian English as much as possible, and consider taking one of these tests again to demonstrate that you're actually achieving well above the standards. As soon as you're successful with the AMC Part 1, you can begin applying for a medical position here in Australia. Most doctors recommend this strategy and not waiting until you complete the Part 2 examination. This is because it can often take a lot of time and persistence to obtain that first position. The downside of this approach is that you'll probably get a lot of rejections and find yourself in a big group of candidates who all just have the AMC Part 1 exam. What job you apply for may depend on what you're intending to head towards in your career, particularly if you're looking at general practice. Bear in mind, however, that most of the doctor jobs in Australia will not be available to you to apply for because you do not have general registration. The most common type of job that might be advertised as available for an IMG is called a resident medical officer or RMO job. These are often advertised at times during the years when the hospitals have vacancies in their ranks. The RMO role is normally a position that is 1 more year advanced from an intern position, but you are generally doing the same roles as interns, for example, acting as the most junior member in the team, looking after the day-to-day patient issues on the ward. The key phrase to look for in any job description that will indicate that you can apply for it is this: eligible for registration. I recommend you watch another video that I shot with Dr. Naj Sumru, where we went into this issue in a bit more depth, and I'll leave a link to that somewhere here or here. However, some of the key things are having a really well put together resume, establishing networks to identify ad hoc job opportunities, being prepared to look outside of the major cities in Australia, and preparing well and effectively for job interviews. It's very important that you ask for a contract once you've been given an offer. There have been situations where international doctors have been offered a job in the past, but this has been withdrawn at a later date. You're really not secure in your job until you've actually started working in it. It's vital that you are responsive during the phase between the job offer and commencing, as you'll need to help the hospital sort out things like your registration and your visa. If those things lag or get behind, this is when the job offer might be pulled. Once you're up and running, you should make sure that you're fully aware of your supervision requirements and ensuring that you're getting regular feedback from your supervisors about your performance and completing the reports that need to go back to the medical board. This is your own professional responsibility. It's much better to identify problems early on in your provisional year so that you can fix them rather than getting towards the end when they become major issues and might actually jeopardise whether you get signed off to go towards general registration. Once you have fully completed the standard pathway process, i.e. have your full AMC certificate having completed both exams or the MCQ and the workplace-based assessment program, and successfully completed 12 months supervised practice, you'll be able to apply for general registration with the medical board. Once you have general registration, you're essentially on a level footing with other Australian doctors who also have general registration, and you'll be able to apply for most of the training program. However, there are some exceptions to this where you will also require permanent residency. For example, the Australian General Practice Training Scheme, as well as the College of Surgeons training programs. So if you're aiming for any of these, you might want to reconsider, or you may have to wait a couple more years until you're able to gain permanent residency. So there you go, there's a lot of common questions and answers about the standard pathway process. Did any of these raise any more questions for you? If so, leave me a question or a comment below. If any of this has been useful, leave me a like. Consider subscribing and turning on notifications so you can get notified about the next video. Don't forget that I do offer things like the ability to help you rewrite your CV, find and apply for jobs, and prepare for the job interview process. So get in contact with me if you are needing any of these particular services, and I will see you in the next video. Bye for now.